Hello, YouTube. Let me get my other stream started here. Start streaming. There we go. Yes, I want to start the stream. All righty then. Let us see where we are. Hello, hello, my friends. It's Jill Osborne from the IC Network. It's time for a support group meeting. All right. Hopefully that will work. Okay. You know what? I need a little spritz. Got a late start today because my mom needed some help this morning. Lots of deep breathing. All right, so it looks like we got Facebook starting. Hello, Facebook. Nice to see you guys. Hello, YouTube. Nice to see you guys. Hi, Donna. So, Donna, you got my email, right? What can you say? Life is adventurous. Hello, Ruth. Hello, Deborah. Nice to see you today. I know that today is a big football day. Niners are playing. Go Niners. So I think a football game starts in about an hour, hour and a half. Hello, Ruth. All right. So my purpose in doing these meetings is to make you so strong, knowledgeable, informed that no one can mess with you again. Nobody can mansplain you. Nobody can tell you that it's all in your head. Nobody can tell you that you're damaged goods. Nobody can tell you that there's no hope. Nobody can tell you that you should give up. Screw them. Screw them. If you've got pain and you have pelvic pain or bladder pain, you have the right to seek care. There is hope, my friends. There is always hope. But here's the challenge here. The challenge here is that we have to rise to the occasion when you feel like crap. You want somebody to come in and rescue you, but guess what? They're not going to do that. We have to rescue ourselves. And the way that we rescue ourselves is with knowledge. We have to try to learn about it. Then we have to ask for help. Many years ago, I taught small business classes for the Small Business Association. I did them as part of a women's group. This was after I gave up pharmacology. And so I used to teach these classes to genuinely low-income women who were trying to find a way to make money, right? It's out on the Mendocino coast in a little town called Fort Bragg. And one of the things that I actually love from that experience was there was a wonderful motivational speaker named Jack Canfield. And Jack Canfield gave a very simple concept: ask, action, satisfaction. That you're not going to get results until you, number one, ask for help. Number two, take some action to get that help. And so ask, action, satisfaction. And it's amazing the number of times I have used that. I mean, I taught that class 30 years ago. And yet even today, it's something that comes up all the time. Like I'm dealing with really funky TMJ right now. And my dentist retired and didn't give us any follow-up. And I'm sorry, my jaw hurts. And I've got a tooth that's rubbing. And the new dentist that I'm trying out, just literally didn't want to look at it last week. It's like, no, it's your TMJ. It's like, it's hurting. Help me. No, it's your TMJ. And, I've been, what do we call it? Ruminating about this, where you can't stop thinking about something. It's going over in your head over and over and over again. It's like, okay, Jill, what's your fundamentals here? Ask, action, satisfaction. So I'm going to ask one more time on Monday for him to look at the tooth. If he won't look at the tooth, I'm out of there. I'm going to go find another dentist. Because we deserve somebody who will listen to us, somebody who will help us understand what's going on, and somebody who will provide therapy, aka action, because I would like this little tiny piece of tooth put down just a little tiny bit because it keeps touching first. And it's been a year and a freaking half. It's like, enough already. It's annoying me. Okay, so anyway, that's my little bitch session for the day. Thank you for listening to me. Hello, Marinda from South Africa. I hope that you are doing well today. I think it's tonight for you. Aren't you like 10 hours or 12 hours ahead of us? So it is 1 p.m. here in California. Hello, Caroline from Dagenham. Kathy, not sleeping, insomnia is so bad. What can we do? What can we take? Melatonin makes me pee more. Tradnosone makes me pee too. Well, this is where it would be really interesting maybe to try some CBD, hun. Okay, and April says, I have IC diverticulitis. So, Kathy, I'm going to come back to that, I promise. April says, I have IC diverticulitis and ovarian cancer. I'm not sure where to begin with my symptoms. Hun, I'm so sorry that you're struggling with ovarian cancer. Have you been doing chemotherapy or radiation? And did your bladder symptoms start after your cancer was found? Anne says, can you take hydroxyzine and amitriptyline for overactive bladder? Yeah, you can. The challenge with both of those medications, hon, both hydroxyzine and amitriptyline, is that they are called anticholinergic medications. And if you take them every day for 3 years or longer, you're raising your risk of dementia. We really don't want to go there, right? Ashley says, hope you can get your tooth. I know, right? It's like, it's driving me crazy. A year and a half. It's amazing how COVID has affected all of us in so many different ways. And one of the ways it's affected us is just getting dental care. You do not even get me started on that. Okay, so April again, did your bladder symptoms start after your cancer? And what kind of therapy are you getting for your cancer, hun? Because chemotherapy, both chemotherapy and radiation have the ability to kind of affect your bladder and potentially trigger some of these symptoms. All right. So, Kathy, let's just talk about insomnia for a moment. So, number one, there are a couple of different things that I think about. The first thing I really actually think about, oh my God, Sherry, hold on a sec, is menopause. That it might surprise you to learn that many women who are in perimenopause or who are going through menopause or postmenopausal struggle with insomnia. That's just, I have moments too where I just like, either I have trouble falling asleep and I can't get to sleep till 3 or 4 in the morning, or I wake up at 3 or 4 in the morning and I can't go back to sleep, right? Throw in the fact that you might have a really tender, irritated bladder. Your bladder is just giving you that constant sense of urgency that's keeping you up. So remember, number one, that nighttime irritation and urination is usually related to something that's happened during the day. That's, we see your sleep quality at night is the price you pay for eating something that's maybe irritating you during the day. So if you're taking a multivitamin, if you're drinking that 1 cup of coffee a day. In fact, I was working with a patient this week, on Friday, who literally was still drinking 1 cup of coffee a day. And she was thinking about surgery and InterStim. And I was just like, no, stop the coffee first. Let's see how you do. So are you doing something during the day that could be tweaking out your bladder at night? So coffee, tea, green tea, black tea, soda, cranberry juice, orange juice, lemonade, limeade, chocolate. My mom ate chocolate last night. Oh my God, yesterday she flared so badly last night. She was up a lot last night herself. A multivitamin, vitamin C, et cetera, et cetera. So in our Friday meeting, because I did a support group meeting on Friday here on Facebook, somebody asked about medical marijuana, and I actually went through this big research study that we did for about 10 years. And so, CBD is not new. I see patients have been using CBD for like 15 to 20 years. And so we actually went through all that old data online during the stream. And what was amazing were the number of patients who reported that using medical marijuana or some sort of CBD product dramatically improved their sleep quality. So I think it would be interesting if medical marijuana is legal in your state. Why not give that a shot? Something else that we have, let me see, where did it go? Here it is. You could even look for something like this, which is a chamomile peppermint. Hold on, can you guys see that? The chamomile peppermint and hemp. This is a CBD from hemp tea, and it's marketed by a company called Harney and Sons. And they believe that this could be really helpful in trying to improve your sleep quality there. So it might be interesting to try something like that. I also have some articles on our website about insomnia. So come on over to the IC Network website, icnetwork.org, and check that out too. All right. So you guys, when I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. So Sherry is visiting Lompoc, California, Vandenberg Air Force Base. Yeah, man, that's kind of my old stomping ground. I was born in Santa Barbara. I dated a wonderful guy that lived in Lompoc. Wonderful country, wonderful country. I hope that I don't know if it's too early yet for you to see all the flowers, because they grow a lot of flowers like tulips and stuff in Lompoc. In fact, I was just thinking about, like, you know, I torture myself with Zoom, right? It's like, if I could go anywhere, where would I go? Because it's like I'm always in my brain looking for where I'm supposed to be, even though I know I'm where I'm supposed to be here in Santa Rosa, California. But if we burn, it's like, where am I going to go? And so I torture myself with Zoom almost several times a week. And I was just looking at houses in Lompoc, as a matter of fact. Ashley says, my doctor just put me on amitriptyline, started at 10 milligrams. Now she is raising it to 50 milligrams. So Ashley, again, amitriptyline. So what the low dose antidepressants can do is they can help calm nerves down over time. They're not a pain medicine, but when you take a little bit every day over time, what it does is it just kind of stabilizes the nerves, right? It kind of calms the nerves down. The challenge with amitriptyline is that it's a pretty tough medication when it comes to side effects. It can cause dry mouth, dry eyes, and an irregular heart rate. And that's what happened to me. I took amitriptyline for about 3 months, and it really, really, really messed my heart up. And I mean, so much so that I had to wear a heart monitor for a month. They were trying to figure out what was wrong with my heart. And ultimately, it just went back to the amitriptyline. So with amitriptyline, you have to be really, really attentive to your side effects, because a medication should not be interfering with your quality of life. It is, if it is interfering with your quality of life, then it's time to talk to your doctor about what can you do besides that. So I know with me, they tried nortriptyline, imipramine. I was intolerant to all of them. The other challenge with amitriptyline is that it makes you crave sugar. And so amitriptyline patients almost always, at least in my experience, gain a good 20 pounds very, very quickly. I did. I mean, I only took it for 3 months and I gained 20 pounds. And as soon as I stopped it, the pounds went off. So you gotta just decide if that's kind of where you want to go. And again, if you take amitriptyline every day for 3 years, and the more you take, the greater the risk, you're running the risk of developing cognitive decline or dementia. It increases that odds dramatically. And in the early research with that, they originally thought that was affecting elderly people, but they then did a study with patients in their 20s who were using amitriptyline and other anticholinergics. And guess what? They also showed signs of cognitive decline. So amitriptyline is in step 2 of the IC treatment protocol published by the American Neurology Association. And so they don't want you to do step 2 until you've done step 1. Doing everything in step 1 first. The 6 steps of treatment are arranged with respect to the risk of adverse event, right? So they don't want you to do the harmful stuff until you do the easy stuff. And so the easy stuff, it's going to be diet modification, it's going to be water intake, it's going to be muscle relaxation, it's going to be maybe acupuncture and supplements. They want you to try supplements before you try medications like amitriptyline, because the supplements carry fewer side effects. And that's not me. That's the American Urology Association IC guidelines. Ashley says, what kind of medical marijuana do you suggest? I don't have a brand name for you. I don't have a brand. The thing about medical marijuana is when you go to the dispensary, you always want to look for the report of the purity testing, because quite a lot of medical marijuana and marijuana in general is adulterated with toxic pesticides and fungicides and things like that. And so you don't want to just believe what they might say, because if you walk into a dispensary and say, I want your best medical marijuana, they could just throw something at you and you could say, is it safe? They're going to say yes. Well, you need more information than that. You need to see a printout of their reports showing that their product is not contaminated, right? So that's the only thing I can give to you. I will say in general, I see patients prefer edibles as compared to smoking medical marijuana. Shirley says indica medical marijuana is best for pain. Interesting. PKusa says she's new here but would love to be a part of this group. Welcome, hun. You're absolutely welcome. Alrighty, let's see. Holy smoke, Pamela. Pamela says here, you have influenza, you have hemophilus, parainfluenza, tested my throat, candida, thrush, yeast. So you have candida and thrush, yeast in your vagina. You're going to a new doctor Tuesday for infectious diseases. Good. Kathy says she's in South Africa. It's 3 a.m. Oh, that's you, 3 a.m. Okay, no, you're not from South Africa. Sorry about that. That was Marinda. Kathy says she's up at 3 a.m. every morning, nothing during the day. So you're not eating anything that, Well, honey, it literally, it could just be related to hormones. It could. Got to talk to your doctor about that. Marinda says, I want to thank you for advice. I have a flare for a month. I had burn in my vagina, my bladder, my urethra, massive spasms, can't urinate mostly. My bladder cramping, it feels like I'm in labor times 10. Somehow the doctor can't get the spasm to relax. The burning is huge. So, Marinda, the fact that you have burning in your vagina and burning in your urethra points us directly to estrogen atrophy. Directly. So you have to remember that your bladder is greatly influenced by estrogen. And if your estrogen levels are dropping, then that means that your bladder wall cannot defend itself like it should be able to defend itself, which would then make your bladder extremely vulnerable and potentially irritated. So, hon, how old are you? Now, the other thing that we all have to understand is that there are 2 different types of muscles in your pelvic cavity that can spasm. Your bladder is composed of smooth muscle. Your pelvic floor is composed of skeletal muscle. And so they require different therapies to get them to stop spasming. A bladder spasm usually occurs as the last couple of drops of urine are coming out of your urethra. Okay. And so if you're sitting on the toilet and you're feeling that last little bit come out, and then all of a sudden you've got this sharp pain that bends you over, and maybe even goes up your back and down your legs, briefly, it's just this strong, painful spasm that makes you go, oh my God, what is this, right? Again, as the last couple of drops are coming out, that's really a bladder spasm. Sometimes you might even feel your bladder kind of fluttering, right? Just a little bit. So the way that you treat bladder spasms is with an antispasmodic like Detrol or Ditropan, also known as oxybutynin. And of course, we have to consider the concept of cause and effect. So the effect is a spasm. It's always important to try to understand the underlying cause of that spasm. So when we think about bladder spasms, which is really kind of, to me, I interpret that as your bladder screaming for attention when you're having a bladder spasm. It's saying, help me, help me, help me, it hurts so bad, help me, right? The only time I've had really bad bladder spasms was when I had a UTI. I had a UTI that I thought was a flare, and I just managed it for 6 weeks. It was getting worse and worse and worse. And then finally, I was bent over the toilet and I didn't want to pee. It hurt so bad. And I actually walked into my urologist's office without an appointment crying. And because I was their support group leader, they had never seen me like that ever. They took me right back and put me into the office of the nurse and said, "Oh my God, Jill, what's wrong?" And I described this bad, I just see feeling. And she goes, "Jill, don't you know that's a bladder spasm?" And I'm like, "No, I've never had this before." The other time that the bladder can spasm, really, if you're just really massively abusing it, you're just pouring acid on it every single day, every single day, every single day, and it's just getting more and more and more and more irritated. Okay, so again, bladder spasms, we want to make sure your urine is good, that you're not pouring acid on your bladder, diluting your urine, maybe alkalinizing your urine a little bit with pre-leaf or with Tums or a little tiny bit of baking soda and a glass of water, like a quarter teaspoon. And let's see if that helps that. And again, the oxybutynin. Pelvic floor spasm is skeletal muscle. Doesn't respond to smooth muscle relaxants. You got to do a skeletal muscle relaxant. So we're going to see pelvic floor spasms often after sex, after trauma, after falling, anything at all like that, that's tweaking out those muscles to a certain degree. And pelvic floor spasms feel weird. Like for me, a pelvic floor spasm feels like there's a hand upside my vagina that's grabbing onto my bits and trying to pull them out of my body. So for me, it's a pulling sensation. And again, I worked with a patient last week who had that sensation for 20 years. 20 years she had this pulling sensation. It started after a hysterectomy. And nobody ever told her what that was. And that was that's a levator antispasm. So sometimes it's a pulling sensation. Other times it's a pushing sensation. You might feel like there's a foreign object in your vagina or in your rectum, or even in your urethra if it's the muscles that are a little bit. All right. Marinda, I kind of one interesting thing. Like if I were you, and especially if you're at home and you can't get into the doctor right away, I would do two things. I would make sure you're using a really good heating pad because heat helps tight muscles relax. So putting a heating pad right over your belly, and just for kind of, I mean, there's just to kind of test it out. I would maybe suck on a Tums, something that would alkalinize your urine a little bit, and see if that would help a little bit. Hello, Lisa. Lisa, do other people get UTIs from taking a bath? I have a great air jet tub, but have gotten UTI. Honey, it's very common. Usually what that means is that the jets are not installed correctly, that they're not draining. See, the jets have to be installed at a slight angle, so any water that gets in the jets will drain out. If the jet is even, or if the jet is pointed this way, water pools at the bottom of it, and it becomes a great bacteria factory that it reinfects you every single time you take a bath. Ruth says, great insight on the psych meds, Jill. Not for me, no way. Hi, Deborah. Hi, Ann. Is hydroxyzine good for IC? Hydroxyzine is an antihistamine. It is a step 2 treatment option. I took it for many, many years. One of the nice things about hydroxyzine is, in addition to being a bit of an having an antihistaminic effect, the other thing that hydroxyzine offers is a little bit of an anti-anxiety effect. And I found that really, really beneficial because I was hella anxious when mine started. I was in a lot of pain. All right. So Marinda is in South Africa. So Marinda, at 55 years of age, you are absolutely in estrogen atrophy. And so are you dry? Is your vulva dry or your vagina dry? If they are, then so is your urethra, so is your bladder. Has any doctor looked at you down there? And if they have they told you that you were dry, or have they suggested using some topical estrogen? Hi, Cindy. Hi, Boria. Nancy, Hoka shoes, got a pair. At first, I didn't think I was going to be able to wear them. I wore them 2 hours a day and they are working. I've had several bones in my foot broken and my feet are not the same size. Getting shoes. Yeah, honey, the Hoka shoes, the bomb. P says, love all your videos so much. Thank you for your expertise and knowledge. I've lived with IC for 20 or 30 years. This is so helpful for me. I had just had a UTI and lost my bladder control. Yeah, what's interesting is my mom got she got pneumonia, not COVID. She had bacterial pneumonia, and she totally incontinent. And then that calmed down. The antibiotics worked. She got out of the hospital. Her continence came back, and then bam, she had her second Moderna shot. Totally incontinent afterwards for like 3 days. And then it came right back. But it's a journey. I have it. You guys know me, you know that I have no shame and I'll pretty much say anything, just to give you the humanity of this. I have a relative, a big distant relative who is quite elderly and is incontinent. And we just found out because she's had some strokes. So cognitively, she's not there anymore. And so her house is a wreck with urine just everywhere. It's so sad. I'm finding an incontinence product that is comfortable, is challenging, especially if you have vulvodynia and you don't like anything touching you down there. They've got this really good incontinence underwear now and menstrual underwear now that is ideal, but she's got so much dementia that she won't wear anything. So it's just tinkle, tinkle, tinkle everywhere. Oh, I feel so sorry for my cousin for having to deal with this. Ashley says, all I drink is water, watered down apple juice, and corn silk tea. What else is good to drink? Chamomile herbal tea, peppermint herbal tea. You might be able to do some rooibos herbal tea. You could do a sparkling water like a LaCroix sparkling water. You could make, because there's no acid in those, you could do make your own spa water. We have a great website. It's one of the fun websites that I do. This called the IC Diet Project, icdietproject.com. There's a bunch of recipes over there on things you can drink. You could have a milkshake. You could make sun tea with chamomile and or peppermint, cucumber. Oh, there's a lot of things you can do. Pear juice. With the apple juice that you're drinking, just dilute it 2-to-1 with water. I don't really like cold apple juice. It kind of makes me nauseous. I do better with, gosh, I do smoothies fairly frequently. I make myself smoothies, and I also make myself these. This is a herbal coffee frappuccino. And so I will usually have 2 of these a day, and I make them with Dandy Blend, and they're lovely. So if you haven't tried Dandy Blend yet, this is fabulous. You can make a hot latte. You can make frappuccinos with it. There's 0 acid in it, no caffeine, and yet it has a great, great flavor. So give this a shot too. You can find this in the ICN shop, or you can find it on Amazon, but I really love Dandy Blend. See, there's my TMJ. Oh, it's on this side. It's so tender right here, just like the muscles. It's not the tooth. The teeth are fine. It's the muscles. Ah. Any TMJ experts out there? I'd love to hire you to help me. Okay. Betsa says, I'm going to ask you again. I don't know if you didn't see my post, but what is my bladder doing when my urethra spasms and I got more frequency? I do not have an infection. So again, Betsa, we're always going to look at estrogen atrophy, and we're going to look at something else that might be irritating your bladder. That bladder spasm really is the epitome of your bladder crying out for help. It's the last thing that the bladder can do to totally get your attention is when it starts to spasm. And that urethra spasm, that's either your urethra, the smooth muscle of your urethra, or it is the levator ani muscles that wrap around your urethra. Lisa says, but air jets are very different than water jets. They clean themselves after every use. But Lisa, how do they clean themselves? Do they clean themselves with, I mean, I'm not familiar with that at all. I just tend to run away from anything that involves jets in water. I mean, if they clean themselves, then awesome. But the other thing too, Lisa, you got to remember there's something called a biofilm. Right? Biofilms are how bacteria live in small populations together, and they secrete this very strong coating over the outside of this little bacterial colony. And it's not just one bacteria, it's a whole bunch of different bacteria that live together. And so basically they huddle together. Then they eat all the food that's available inside the biofilm, and then it breaks open, they all leave, and then they all come together again and create their biofilm. And again, they eat the food that they've collected or whatever. And then, so it's constantly releasing and whatever. So you could have a biofilm perhaps on one of the surfaces, maybe. I mean, I don't know if you've noticed this, but when you go to the dentist now, they don't normally use their water jets anymore. They usually have a little paper cup of water that you use to rinse your mouth, because there's massive biofilms now that they've discovered in the dental water piping, which is why they haven't used it for years and years now. Hello, John. It's so nice to see you. And I use a night guard. The thing is it got much worse with the night guard. That's a crazy thing. I couldn't get a night guard for like 9 months. And I was the stress of COVID was brutal, and keeping my parents alive during COVID and fire season. Listen, my stress absolutely manifests in my neck and in my TMJ. No doubt about it. That's where it hits me. But I couldn't get a guard for like 9 months because my dentist was closed. And then I broke some teeth from grinding my teeth and waited even more. So I've only had a good dental guard for like 6 months. And then my new dentist went, this is exactly the wrong guard for you. You should never have had this guard. And he broke it in half. So I just can't find a happy point in my bite. My bite is there's just no happy point when I put my teeth together. There's this one little edge on the inside of a molar that's hitting first. Mary says, I have TMJ too. Wearing a bite splint helps. Yeah, the bite splint helps at night. But the thing is when I wake up in the morning and I take the damn bite splint out, my bite isn't right. And it started immediately after I lost this molar, right before COVID. I lost a lower molar. And it's like, and I said to the dentist, I said, listen, it all started after that. Well, I had to have this other tooth pulled, and we couldn't, because of COVID, I couldn't get the implant and the replacement. And the bite where it's hitting is exactly the same place on this other side. So I think it's just this weird compensation for this lost tooth. They shoot out air for about 20 minutes. Interesting. It's like once every 10 years, my TMJ goes bonkers, but this is the worst outbreak I've had. Like, I haven't been able to sleep in my bed for a year. I'm sleeping in the recliner in my family room. And when I sleep on my bed, my jaw starts to dislocate. So I think my jaw feels very unstable to me. Like, this side's very tight, and this side's now it's being pulled apart because this side is so tight. And I understand that. And I understand that I have very, very, very tight muscles right here. And I haven't been able to get a massage in 2 years. So I'm always working on this. But like, the muscles here hurt. The muscles right here are very tender. And I can even, do the massage on the inside. I don't know. We're all weird. John said, my TMJ problems mostly disappeared when I had a dentist take the time to thoroughly adjust my, I know, exactly. I think that's my bite all the way. I mean, like this new dentist that I went to see, he wouldn't even look at it. Like, I was there on Thursday. He wants to do Invisalign for $6,000. And it's like, well, wait a second. There's one spot on this one tooth that needs help. Please help me with this tooth. He wouldn't even look at it. He said, well, we'll look at it in a month. I want you to wear the mouth guard for another month. It would be irresponsible for me. It's like, no, I've been dealing this for 14 months. It's a little tiny edge. Just take this little tiny edge off, please. And he wouldn't even look at it. I've had it. He's going to get one more try on Monday. I'm going to call and say, listen, I have very important things I have to do. I have very important meetings. I cannot be dealing with this constant pain. Life, right? My email address is icnetwork@mac.com. PK says, what is the best treatment for IC that is not Elmeron? Well, PK, a lot has changed. So since you problem happening in the pelvis. And so today we're getting diagnosed, we're doing a much more, well, the top tier doctors are doing much more individualized diagnostic workups, because we don't want you to do bladder therapies for 30 years if you don't have a bladder issue. Like for me, I mean, I started out with massive antibiotics when I was a kid, and then